Hey everybody! So in this video, we are going to be talking about therapy and DID or OSDD and what kinds of therapy have worked for us and what kinds of therapy we would recommend. So first, let's start with the most important aspect of any type of therapy for DID or OSDD, and that is that the practitioner specializes in dissociative disorders. Now, this is not always easy to find, and if you cannot find someone who specializes right away, try to find someone who at least has a fair amount of experience with dissociative disorders, because in therapy, you are going to need somebody who understands how dissociative disorders work, how dissociation functions, and how OSDD or DID presents. Now, as for what kinds of therapy work well for people with DID or OSDD, that is going to depend largely upon the individual system. What's going to be the best method? A lot of people fare really well with your standard talk therapy, EMDR, which is eye movement reprocessing and desensitization, can be very helpful if done by a skilled practitioner who understands how to work with the DID system or OSDD system, because this particular therapy helps to reprocess these traumatic experiences and remove the emotional responses to them in the present day. Cognitive behavioral therapy can be very helpful for different system members who struggle with anxiety or depression or varying different levels of negative self-talk or otherwise maladaptive thought processes that are just negatively impacting their lives. Overall, the specific type of therapy really isn't as important as having a good relationship with the therapist and having a therapist who understands DID or OSDD and is willing to work with each individual system member who is willing to be present. Now, that's really important. If you are going to work with a therapist for DID or OSDD, you need somebody who is willing to talk to whoever wants to talk to them, whoever happens to show up that day, because if they are only willing to work with the host, they are not going to be helpful. The host is not the only important person in the system. Everybody matters, and everybody needs to be heard, because everybody has their own specific trauma to work through. Now, PTSD is also incredibly common. I would say, just based on my experience and talking to other systems with DID and OSDD, that probably every, if not almost every system experiences some PTSD symptoms or has at least one system member with PTSD. And so PTSD work can be very helpful, especially because DID and OSDD are trauma-based disorders. So workbooks from your local library, workbooks from your therapist, these can all be incredibly helpful. Now, another important factor is being willing to do the work. If you have system members who are resistant to the idea of therapy, that is going to be something you're going to have to work on first, because nothing is going to get accomplished if there are people who don't want to be there or don't feel that it's safe to be there. So you're going to have to communicate with your system members as best you can and figure out a compromise that works for everybody. Now, the first step in therapy, of course, is building that communication. So you're going to want to figure out how to communicate with your system mates and what works best for you, because everyone is different. For some people, that's going to be using a journal. For other people, that's going to be talking internally. Or still others, it's going to be leaving video messages or phone messages. Whatever works for you is the best option. Now, the second thing that is very important to focus on in therapy is being able to stay present. What that means is that when you feel yourself dissociating, which over time you can come to figure out exactly how you experience dissociation personally and what it feels like both mentally and in the body. But when you feel yourself beginning to dissociate, you can use grounding techniques or other techniques to bring yourself back, to stop the dissociation and to keep yourself present. This is helpful when you are in a situation where it would not be safe for another system member to be present, or where there is no actual danger and you really need to be out to do something that needs to get done. For instance, you're grocery shopping or you're at a doctor's appointment. You need to be able to stay present so that you can communicate what it is you're there to communicate. Now, the third thing that is going to be extremely important in therapy is helping each individual system member to process and heal from the traumas that they themselves have experienced. Now, a lot of people think that means that they have to dredge up every memory of trauma that every system member holds, and this is not true. You do not have to bring up the trauma memories in order to heal from them. You simply have to allow each individual system member to process their trauma and to heal from their trauma on their own. That does not mean the whole system has to share all of those memories. Now, if you want to all share those memories, then that is certainly something that you can do, and that's something that will be carefully monitored and done with your therapist's help. This is not something to go digging for. I repeat, do not dig. Because trying to dig for trauma memories can be re-traumatizing. It can create all kinds of destabilization. It's just not a good idea. But with a trained therapist's help, you can unearth these memories as your mind is ready to process them, and then you can deal with them. But if you do not wish to do that, it's certainly possible. Now, another important factor when it comes to therapy is, how do you want things to end up? What is your goal? Do you want to integrate, which means bringing all of the different system members together into one singular identity? Do you want to break down the dissociative barriers and function as one individual while still staying multiple? Do you want to develop cooperation? What is your end goal? That's an important thing to figure out, and that's something that the whole system has to figure out together. One individual does not get to make that decision for everybody. It has to be something that you all agree on and you're all comfortable with. Like, for us, we have decided that our end goal is just to be cooperative. We want to break down the dissociative barriers so that we can all communicate, and we want to have a shared awareness. We want to integrate consciousness. What that means is that we want to all be able to be aware of anything that happens when anyone is out. We are not planning to go looking for the trauma memories. We are not intending to integrate into one singular identity, and we are not intending to go looking for every individual trauma and making it so that every single system member is aware of every bad thing that's ever happened. Our goal is to simply get to a point where we are all able to be aware of anything that happens when anybody's out. We are all able to talk to each other, and we are all able to function cooperatively and cohesively so that we can all live our best life and everybody gets to be happy and healthy. That is our ultimate goal. Well, I hope you guys have enjoyed this video. If you have, please like, subscribe, and don't forget to hit the notification bell. Have a good day, everybody.